The absolute worst time to look for a memory care facility is when your loved one is going to be discharged from the hospital or being kicked out of independent living, because now you're in a rush. You don't want to be rushed into a decision. I have a video out titled, "Should I Put My Loved One in a Nursing Home?" And that video goes great with this one, especially if you're in conflict with making that decision. I'm Debra, certified master dementia strategist, and today, well, it's going to be interesting to say the least. I have some very personal opinions and observations about memory care units or special care units or SCUs. I'm not going to hold back on this one because I have such extensive knowledge on the subject of dementia. I really can't believe what I see and hear in memory care facilities. So let's just say, for the sake of this program, that the decision has already been made to make the move. How can you make the best choice possible? What should you look for? And what questions should you be asking? In most cases, this is a last-minute thing. Let's face it, most of us haven't spent the last few years thinking, what would I look for in a dementia community? So that's why I'm here. I got you. First, I'm going to say that I am a firm believer in home care. Nothing beats one-on-one care. But sometimes that's not an option, and that's okay. So if you're going to look at memory care facilities, the very first thing you should do is take a really good look at the person that will be moving. What is their status? Think about their personality, their mobility level, and medical concerns. Would they like an active setting or a more quiet community? Remember, this is for them, not you. Does your loved one use a cane, a walker, or a wheelchair? Will they have difficulty getting around? Are the distances from the meals and activities really far for them? Does your loved one suffer from any chronic medical conditions that might be a cause of concern for the facility? For instance, is your loved one a diabetic and they may need help now or in the future with insulin injections? Do they provide this level of care? Does your loved one need to go to frequent doctor's appointments or dialysis? What would that look like? How quickly is your loved one likely to decline? Will they likely need to make another move sooner than later? Let's talk finances next. Everybody loves to talk about money, right? How much will the community cost? What's included? What is not included? Be prepared to show the community financial reports and bank account statements. Many memory care facilities are private pay. It's important to ask, what happens if the money runs out? Do they offer any Medicare or Medicaid beds? How fast would your loved one have to move out? Will they assist you in finding another community? What if you don't approve or like the choice of the new community? And how quickly would you have to move if the funds run dry? What if you moved your loved one in and decided later on that it's not a good fit? What's your commitment? How much notice would you have to give to them to move out? Man, you better be writing this down. This is a lot, and we haven't even gotten started. We're not even on the tour yet. All right, before we go on to the dreaded tour, you must remember that when you are on the tour, you are talking to a salesperson. They're going to make a commission check if you sign. So keep this in mind. The tour guide's job is to paint a beautiful picture for you. They are paid to tell you what you want to hear. And they are very nice, and they're going to try very hard to make a connection with you. Now, there's nothing wrong with that, but just keep that in the back of your mind. This is a salesperson. They'll do their job. It's up to you to do yours. Now, before we start discussing what's next, I want to share with you that for many years, I was the owner of a home care agency. And during that time, my team, worked in all the dementia units. So I know, I've seen, I've heard, I've experienced it all. One of the biggest disappointments was when we would interview aides from these memory care facilities, and we, of course, would ask, what dementia training have you received? And consistently, over a decade, the answer was, not much, or a couple of hours at orientation, or I was trained to pass meds. That was the most common response. I was trained to pass meds. These communities are supposed to be specialized. They are being sold to people as specialized dementia care. And in my personal experience, it's mostly just a locked environment. The training and techniques are lacking big time. I've been on the phone with caregivers and heard employees in the communities yelling at the residents in the background. Can you imagine yelling at them in their home? Oh my God, hold me back. Any of you memory care units out there, contact me. I can come and train your staff. Email me at Debra, Debra, at answersaboutalz.org. Okay, touring. Choose several to visit. Use all of your senses. Look past what they are showing you. So again, keeping your person in mind and what they would like. It's not so much about how pretty the community looks. It's about the people. When you're on a tour, notice the employees. Are there several of them around? Do they make eye contact with you and say hi? Are they smiling? Are you seeing the staff actively interacting with the residents? Where are the residents? Are they scattered throughout the community? Are they in their rooms? Are they all lined up in the hallway or around the nurse's station like a parking lot? Have they been rounded up and sitting around the TV? Is it an active community? And is the activity productive and positive, or is it rushed and task-oriented? Is it a stressful clinical environment? Are you hearing residents calling out for help? Help, help! Or calling out, nurse, nurse, or no, no, or calling out anything? This is a big red flag. A person calling out is in distress. They have a need. They are afraid. If a facility is saying that this person is fine, they don't understand. They don't have proper training, and they don't have any compassion. Cross this community off your list, say goodbye, don't even waste your time finishing the tour. Is the community clean? Seriously. I once saw a resident remove a sofa cushion in the TV area, and oh my God, literally, piles of junk and crumbs and food in there. I mentioned it to the director, and I even told her that my client loved to clean, and she would absolutely love to clean it up. 3 times I told the director, and guess what? Never cleaned. Absolutely disgusting. When you see other residents while on your tour, go up to them. Say hi and shake their hand. Introduce yourself. I do this all the time. Are their clothes clean? Is their hair clean and combed? What about their fingernails? Are they crusted over and gunked with food and God knows what else? Are their glasses clean? Do they smell like urine? You can tell an awful lot by stopping for 3 seconds and shaking the hands of a few residents. Is this good or what? Is this helpful? Comment below and subscribe. When you're asking questions, try not to feed them the proper answer. Ask about the admission process. Ask about medical records. Hopefully, they will volunteer to you that they ask for a personal history about the person to get to know them better. So don't ask if they do that or not. They should volunteer that information to you. If they do fill out a getting to know you questionnaire, how is that information forwarded to the staff? I have found in most cases, this gets filed away with all the other paperwork and it never fills the intended purpose. Shake my head. You should ask about staffing. How many staff per patient ratio for the day shift and the night shift? Do they have an RN or doctors on site? What about the weekends? Ask this. If my mom or I thought that she had a UTI, what would be the time frame to get a urine culture ordered, collected, and get the results? Or would I need to take her to an urgent care facility for that? Would that urine be able to be ordered on a weekend? What if my mom decides she doesn't want to put on her pajamas and go to bed? What would happen? The answer should be, we would give her some space and reapproach. If she still insists on keeping her day clothes on, it's not a big deal. So here's the thing. The director, the marketer, nurse, maybe, might have some dementia training. But who is having the most contact with your loved one? Not the director, not the salesperson, and not the nurse. It's the aides. It's housekeeping. It's dietary. It's the activities director. They are the ones who should have the extensive dementia training, right? So, the next question you ask is, tell me about the dementia training. Do you do anything over the state requirements? What's in the training? How long is it? How often? How do you handle aggressive behaviors? Walk me through a scenario and tell me a couple of solutions to a specific behavior. Tell me about the techniques your staff uses for a person who is exit seeking or refusing to bathe. If they know what they're doing, you'll know it because you're going to watch my bathing video and some behavior videos before asking these questions. If the salesperson knows how to handle it, you need to ask if the aides also know these techniques. Every community has an activity calendar. Are the activities ones that you think your loved one would enjoy? Are they simple enough yet not childlike? Is the staff talking to residents in an adult tone and speaking with respect? Oh my God, I could literally go on for a whole day on this. If my person is having a rough patch, like a behavior or wandering or sundowning or has the flu, or maybe they were just discharged from the hospital, can I come and stay a few nights with them? Have you ever notified a family that they had to hire an outside agency to provide 24/7 care for behaviors or exit seeking? Listen, communities only have so many staff. I've actually had to back up communities on this. You're signing up for community care, not one-on-one care. There may come a time when you will need to add another layer. Hopefully it's just temporary. but it can happen. In most of these cases, I discovered that the problem is really due to a lack of knowledge and training for the employees, and they just don't have the skill set to overcome or solve the problem behavior. I can usually figure it out after working with the person for one day, sometimes as little as 1 hour. Ask the community what model they use to assess pain. If they don't have a quick answer for you, this is a huge red flag. People with dementia cannot express or communicate that they are in pain. All memory care facilities and nursing homes should have a particular pain assessment tool that they actively use. If they can't quickly answer this question, then they are not tuned into those with Alzheimer's or dementia, nor do they have the empathy for that. I know this is a lot. It is. I agree. We shouldn't even have to talk about this. This should be standard care, basic human rights. But it's not. It's a damn shame that you have to learn all this so you can do your best to keep your loved ones safe, happy, and healthy. Ridiculous. I'm sorry. It should be better. Way better. I would also ask about what would constitute an eviction. On what grounds would they evict your loved one? One of the ways these communities get rid of problem residents or problem families, yeah, I said it, problem families, is to send the patient to the hospital and then refuse to take them back. Yeah, that happens more than I'd like to admit. And again, it's usually not the resident's fault. It's a lack of training. We must stop blaming the person with brain damage. Oh my God. So this is just the tip of the iceberg. I'll do another video more in depth, and I'll get a form up on the website with a list of questions for what to look for in a memory care ASAP. It'll be on my website soon at answersabout.alz.org. This is a very aggravating subject to me. It makes me very, very angry. The things I've seen, just do your best. That's all we can do. Push for change. Stand up for what's right. Join my fight. Together we can. Reduce your stress and build your confidence by watching more of my videos. There's even more content and videos on my website at answersabout.alz.org. Would you like to get these same results? This course comes with a 100% money-back guarantee. Join me for the next session before the class is full. To apply, go to answersabout.alz.org or give us a call at 585-775-5949 today.